Hi everyone, my name is Erin. I work at Baptist Health in Paducah as an MLT. I know it's cliche, but one of my most favorite departments is blood bank. Well, when it's not being overly stressful. When there's an antibody on a patient that needs blood in surgery after already receiving 2 units that were set up previously. Don't worry, you will. Anywho, I've always thought that the American Red Cross or Kentucky Blood Center would be a neat place to work. These places collect and do extensive testing on blood products and distribute them out to hospitals. They not only give you the products you order, but also work up any problem patients you may have. Currently, blood centers offer testing for many different pathogens, including Trypsinoma cruzi, hepatitis B, hepatitis C, HIV, human T lymphotropic virus, syphilis, Zika virus, West Nile virus, and Babesia. Unfortunately, there are many more bloodborne pathogens that are not tested for, but are more rare. This is where pathogen reduction technology comes in. By using this technology, we can reduce the restrictions that are currently in place for donors and zap the bad stuff away. Okay, well, that's not exactly how it works. Mirasol, it's one of the types of pathogen reduction therapies available. It can be used for whole blood, plasma, and platelets. They use a combination of riboflavin and UV light to stop pathogens from reproducing. Here is a quote from the Mirasol website. The Mirasol PRT system uses a combination of riboflavin, vitamin B2, a non-toxic, non-mutagenic compound, and a specific spectrum of ultraviolet light to inactivate viruses, bacteria, parasites, and white blood cells that may be present in collected blood products. Here you can see the 3 easy steps that they use to kick pathogen butt. First, they transfer the blood product to a special storage bag. Then they dose it with riboflavin, which is vitamin B2. Finally, they expose the bag to a special wave of UV light. And voila, it's pathogen reduced. Mirasol can inactivate white blood cells, which means transfusion reactions are less likely. That's a good thing, I promise you. Another system for pathogen reduction is called Intercept. Platelets and plasma components are pathogen reduced with this system. Intercept uses a photoactive compound called amatosalin and UVA illumination. The amatosalin targets DNA and RNA and sets itself up between nucleic acid pairs. The UVA illumination activates the amatosalin, which causes cross-links between the pairs. The cross-linking keeps the pathogens from reproducing and makes pathogens and white blood cells inactive. This slide shows you just how many bacteria and virus it inactivates. It even works against a few parasites. As you can see, this list is much more extensive than the Blood Center's testing menu. I'll give you a minute to look through these, as I'm pretty sure I can't pronounce half of them. Unfortunately, these systems are not available in the US yet. The FDA and doctors from all over the country are looking at different ways for decontaminating blood products. This is Dr. Michelle McLean from the University of Strathclyde. She is actually researching the effects of blue light decontamination of platelets and plasma. She has so far experimented with Staph aureus and has had good luck at reducing that bacteria by 100%. Here we have Lieutenant Colonel Andrew Capp. He is the Chief of Coagulation and Blood Research. He says that the military are supporting intercepted Marisol as it gets introduced to the United States. He explains how much of a miracle these services provide the active military. So when will we be able to use this wonderful technology? The American Red Cross says they will be moving towards pathogen reducing all platelet products by 2023. This is great news for the patients and hospitals alike. Here are some resources that I've found for you if you'd like to learn more. Pathogen reduction therapy is very interesting and has endless possibilities. I'm excited for what the future holds, and you should be too. Good luck to all of you, and I hope you have a wonderful day.